Roxy, we're ready for you. All right, so we're gonna show you guys how to do physical exams. Generally, you guys will help us a lot to get them started. So this is the form that we fill out for each patient. You will fill in the first name, last name, girl or boy, date of birth, age, and then the rest of this we'll generally ask them, or it's based on vital signs. So we're gonna start our physical examination with the patient's weight. So you ask the patient to take off their shoes. One thing you always ask them. And then they'll step on the scale. So you want to make sure you stay on the pounds. So you want to go up to say 100 and then move it over. Wait for it to go down. So that's too much. Come back. Anyway, once it stays like in the middle, that's their weight, and we write it down in pounds. Be sure to zero out the scale. Don't want to mess it up. After that, you will ask the patient to turn around and you will do their heights. So, they're going to stand here and do their height. So the way you read this is you ask them to step off and we write it down in inches. So this is 5 feet, which is 60 inches, and then you will start adding from there. So I am 5'3", as you can tell. And that means 63 inches. So we will write it down here as 63 inches. And then we'll zero this one out too. So the next test we do is the eye exam. So over here you will find the eye cover and the reading list for the exam. So this is where you find the cover, and you always want to wipe it in front of the patient. With the alcohol wipes, which you will find here. And then you will find the reading test in here as well. So you can grab that when you grab that. You will ask the patient to stand behind the blue line that we have marked here with tape. They will stand there, and you may ask them to cover left or right based on how you want to start writing it down. So as they're going down the line, there are numbers on the corner where it says 20 over 20, 40 over 20, 20 over 40, 20 over 30. You will read it down as the patient is going, and if the patient makes more than 2 mistakes or makes 2 mistakes, you will not count that line as being read. You will write down the number that they did get correct. So if they missed these 2 or these 3, then you will write down 20/50 if they got this entire line. So you'll write that down. So you will ask the patient to read it basically 3 times to you. One with the right eye, one with the left eye, and then one again with both eyes. And then you will move on to the reading test. So there is no line to write down the reading test, so you're actually going to write it in. Write down reading, and you're going to make a spot for you to write down their reading score. So in order to do the reading test, you will ask the patient to hold this in front of them and pull it a little bit closer to them just so that they can see a couple of them. And they will read down the numbers to you. There are a couple codes in here, X's, O's, and E looking things, but they don't need to read that to you. They only need to read the numbers to you. And then again, you will use the numbers on the corner to tell you what their score is based on how many they get right, and then up to which line they read to.
So I'm here in the lab with my patient Cindy, who we just weighed and also got her height, also examined her eyes. So here I'm continuing to write in the top part of this assessment paper, and I'm going to take her vital signs. So I'm going to start with her temperature. Here is where we keep the thermometer, next to the sink in the lab. The thermometer has covers on it to keep it clean for every patient. So you take it out, you pop one of these plastic covers on it, and it's ready to go. So I'll stick this under Cindy's tongue. It'll think through the calculation of her temperature, and when it beeps at the end, that's the final temperature that she has. So you've probably taken a temperature before. You just have the patient lift their mouth, lift their tongue, I'm sorry. Open their mouth, lift their tongue, close their mouth with this prod under their tongue. So there goes that. You can say abre su boca to a Spanish-speaking patient. It thinks through the temp. 98.6 is her temperature. So that's normal. I have a button on the end of my thermometer. I shoot the plastic into the trash and put it back in its case. I can write down that her temp is 98.6. Here's our normal temperature range, 98.6 to 99.1. If the person has a fever, the practitioners need to know about that ASAP, and we also give them a mask to cover their mouth because they are likely contagious. So we're going to continue assessing vital signs with blood pressure. This is our automatic blood pressure cuff monitor, and this is our cuff. So this is the standard adult size cuff. It goes around the arm. There are larger sizes should we need to use one for an overweight adult or just a larger person. So what's important is that you find where it says artery index marker, because that indicates where the brachial artery is in the arm. And where it is in the arm is on the inside right here. You can even feel a pulse here. So what you need to do is take the patient's arm, make sure that this line is lined up with just about where their brachial artery should be. Wrap it around their arm and tell them that they need to relax the arm. All you need to know on this machine is the power button to turn on the machine and this white button that indicates that the cuff will begin to squeeze. A lot of adults struggle with high blood pressure. What you need to know for your normal ranges of blood pressure is 90/60 to 140/90. So 90/60 is the lower end of the normal range and 140/90 is the higher end. If the blood pressure is higher than 140/90, write it down, but also check the blood pressure again. We just want to verify that this high level is not an error on our part, but it is actually high. The cuff will beep when the blood pressure has been read. So how you write down a blood pressure is like a fraction. So the higher number over the lower number. So Cindy's blood pressure is 109/74, which is a good blood pressure. It's normal and low. So I can write that down next to where it says BP as a fraction. 109/74. This also calculated her pulse for me, which is indicated here. So her pulse is 80 a minute, and that also falls in our normal range, which we have indicated here is 60 to 100. So I'm going to take this cuff off of Cindy. I'm going to write down the heart rate and the blood pressure, and then I'm going to move on to calculate her respiratory rate. Respiratory rate is the number of breaths you take in a minute. It's a good way to measure if someone is having issues breathing or issues with circulation or anything like that. It's just another safety and normal thing to calculate. So a normal respiratory rate is 12 to 20 breaths per minute. Now, obviously, if you tell someone you're going to count the respirations, it's going to be difficult for them to breathe normally. So we tend to not do that. I tend to pretend like I'm taking a pulse of a patient, and I do look for 30 seconds at my watch, but I'm also making note of how many times her chest rises in those 30 seconds. So if the patient is talking, that's also not going to have a valid respiratory reading. So take time to let the patient finish what they were saying to someone else. Go ahead and fake, like you're not paying attention to the breathing, and then you can count for 30 seconds. Multiply that by 2 because we want to know how many breaths they take in a minute. And it should be between 12 and 20 breaths per minute.
So at some point in the examination, you will ask the patients to answer a couple questions and fill this out, such as marital status, date of their last physical, primarily language, occupation, last menstrual period, and for all of that we have a cheat sheet. If you don't know much Spanish, there is a cheat sheet and it tells you how to say certain things like ¿Cuál es su ocupación? What is your job? ¿Está casada o casado? If you're married. ¿Cuándo fue su último examen físico? When was the last physical date? when their birth date is, cuál es su fecha de nacimiento, and then you will be able to kind of read that down to talk to them.
Ask the patient if they're married. We've asked them when their last date of their last physical was. We've asked them about their job, their primary language. We also asked them if they're fasting, which means they stopped eating last night, the night before their appointment at midnight, and they haven't had anything since. This is important for us because we do a lot of diabetes and glucose checks here to screen for diabetes, and if they have eaten, it messes with the results of the test. So there's a spot for both glucose and hemoglobin on our patient history form. Those are both procedures where the patient's finger gets pricked, and because of that, we ask that only the externs or other nursing or NP students do those procedures. So a volunteer med student or any other volunteer is not allowed to do a glucose or hemoglobin check. So after we have all these things done, we're going to ask the patient to give us a sample of their urine as well, because we also screen for other abnormalities that could be in the urine. So that'll be our next thing that we teach you.
Okay, so for the urine sample, we do provide a cup for each patient. You will write the patient's first name, last name. You can do initials, but we always want to write their date of birth. That way we can confirm that it's the correct patient. So we send them in with this little cup, and then based on whether it's a female or a male going into the bathroom, we will give them these towelettes. So women get 3 and men get just 1. So you will ask them to wipe before they put in their urine sample in here. So you may have to do a little bit of Spanish talking to them here. So what you will explain basically for the woman is that they will use one to wipe down their right side with one, their left side with the next one, and then down the middle with the third one. And then men generally is just one wipe on the top. So in Spanish, you would ask them for un ejemplo de su orines into this cup, and you will ask them to limpiar hacia abajo, un lado, el otro, y en medio. So that way they know they have to clean before they put their urine sample in here. So you'll send them in with this. So once they do come out, we have one kind of ready. It has water, don't worry. So we will open it using gloves, of course, so we want to stay protective. But because it's just water, we're not using any gloves. And you will pick a strip from this little container, and this little strip will be dipped into the urine, and you will leave it sitting for a good minute, wait for it to dry, and then you can put the urine away. And we'll wait to see the results. So let's say we waited a minute. We will use this to calculate which indication of glucose, leukocytes, protein in the urine. So you'll hold it up like this next to it, and you'll read down. And we have this form that we fill out according to the strip. You'll write down whether it's negative, it has a sign of protein, glucose, or anything in it, any blood, and then this gets signed and sent with the patient into the room. Oh, and 2 people will do it. So you do have one person who is the scribe will be writing that down, while the other person is with gloves holding this down and reading it together. Alright, so we did vital signs, we did the urine sample. We're going to leave the lab, and we're going to ask the patient to go into the room. But before the patient goes in the room, of course, we want to set it up. So I'm going to show you how to set it up first. So we'll walk over to exam room 2 here. The light will come on. This is the bed. You want to pull this out so that the patient has somewhere to step on when they sit. And then on the side here, there are a couple little drawers. You will find chucks in here, which you will want to place first. Chucks down for them to sit on. In the next drawer, you will find a vest, and you will explain to the patient, of course, when they come, how to put this on. So you want them to place their hands or arms into the 2 holes, and you want the opening on their back. So that's one thing you will definitely explain to the patient. when they walk into the room. So this will be placed here in the meantime. And then one extra thing we like to leave in there as well is this white cover, which will just be placed here. That's just for some extra cover up on their lap, which we will also explain to the patient. Now, when you do set up for a female, we may have to set up for a pap smear as well. So using a different trucks, you will place that on this tray here. We'll place that down, and you will go over here to the cupboard where it says pap smear. You will grab one of these spatulas and one of these brushes. And then you will get the lubricant and add a big pile of lubrication for them to use. And that's how you'll set it up for a pap smear. All right, so we showed you how to set up a room. So once the patient is out of the room, we'll generally be doing the blood draws in the lab, back in the lab. So once the room has been used, we'll have to clean it. So one way to clean it is to just put everything in a big ball of trash. I have to rip this off, roll this up, and then this will generally be already thrown out. But we will use these wipes, cavity wipes. Be sure to wear gloves when you use these because they can be toxic to your fingers. And you will use those to wipe down the tray and then wipe down the bed here. First, without this, we'll wipe this, and we'll wipe down the counter over here as well. And then you'll get ready for the next patient, or just put on a new cover here for whenever this room needs to be reused.
Thank you for joining us. We're glad you're volunteering here at the HPC, and we can't wait to see you soon.